Yes. Okay. Thank you all for coming. I know some of you have come from far away. We had NAMPIP people here in Meridian and Boise. I've had a couple people ask me where the restroom is. So if you do need to use it, you could just go out this door and hang a right, and it's just down the hall on the left. So that's where the restroom is. My name is Lisa Tuman. I work for Medtronic. I have the pleasure of working with Dr. Parrillo. I've worked with her for the last 7 years, and we have partnered together to help the community with education with the topic that you guys are here tonight for. Yes. Okay. Is it better if I step away? No? How is it now? That's better. Can you hear me? Okay. So we're here tonight to help educate you guys on the topics of overactive bladder and fecal incontinence. Dr. Parrillo is going to do a presentation. Save your questions for the end because she'll take questions at the end, okay? So you can just raise your hands and just ask those towards the end. I'm just going to do a quick introduction on Dr. Parrillo. Dr. Parrillo is a board-certified reconstructive urologist. She joined Idaho Urological Institute in 2017. She attended medical school at East Virginia Medical School, and she completed her urology residency at the University of Pennsylvania and completed her fellowship in genitourinary, sorry, that's a hard one, reconstructive surgery at the University of Colorado. And now we are lucky enough to have her here in our community. Dr. Parrillo offers a variety of different services aside from what we're going to talk about tonight. Some of those services are reconstructive surgery, treatment of erectile dysfunction, multimodal treatment of overactive bladder and urinary incontinence, robotic treatment of urethral strictures and prolapse, treatment of urological cancer, urinary infection issues, and also vasectomies. She is a member of the American Urology Association, the Society of Women in Urology, as well as, here's the word again, genitourinary reconstructive society. Dr. Parrillo sees patients in both the Boise and Meridian office. So there's 2 different locations to see her at. And she is a very active person. Just a few fun facts about her. She's a runner. She's a jogger. She likes to mountain bike. She likes to hike. She'll probably get mad if I tell you this, but she's on a 100-day jogging challenge where she runs a mile every day for 100 days. And she is well into it. So hardworking with the community, with her medical profession, as well as outside with her recreational activities as well. So without further ado, I'd like to welcome Dr. Parrillo.
Hi guys, thank you so much for coming. I'm Lisa Parrillo. It's very nice to see all of you. I know it's hard to do things on weeknights at 6:30, so thanks for taking the time to come here. I'm going to talk to you both about urinary and fecal incontinence today. These slides come from Medtronic, and I very much appreciate Medtronic hosting this event tonight. I'll stay on book on some of the slides and then kind of talk for myself on some of the other ones. So don't follow me word for word, but I do appreciate all of you coming. So I often get asked why I became a urologist, and incontinence is one of the main reasons. Actually, it's something that we don't talk about in society, but really changes one's quality of life. And I take great joy in helping people improve their function. Like there's all of these reasons why their lives are really greatly affected by both urinary and fecal incontinence. And there are things that we can do to help. And that's one of the best parts of my job. These issues are not inevitable, and you may have them if you have some of these symptoms. How often you go to the bathroom during the day is also a product of how much you drink. So take that 8 times a day with a grain of salt. But if you have the feeling that you have to go really urgently, like you can't hold it to go to the bathroom, if you find that you're planning your life around stops in the bathroom, you're altering what you drink, especially your water consumption because of how often you have to pee, or you find that you're using pads to control your urine. Those are all good reasons to come and see a urologist in general. Additionally, it is normal as we age maybe to get up a little bit more at night, but if you're getting up over and over again, that's another thing that seeing a urologist may end up being helpful for you. This is a really common problem. We see it in little kids. We see it in older individuals. It tends to become more, it tends to affect more of the population as we age. And in fact, 1 out of 6 adults have urinary issues, and 1 out of 12 adults will have fecal continence issues. That's a lot of people in the US, 43 million and 21 million. But there are things that, you know, you don't have to live with, we can help with, and we want to help with, as the slide says. So what are some of the things that can cause bladder and bowel problems? Your habits, your behaviors, your food and drink can affect both of these things. There are side effects to certain medications or supplements that can affect bladder and bowel health. And then for women specifically, we do see often the worsening of bladder and bowel health associated with pregnancy, childbirth, other pelvic injuries, surgeries like hysterectomies in the pelvis. So all of these things can contribute to dysfunction from a bladder and bowel standpoint. This slide just sort of looks at how does everything work together, and there is a nerve contribution to these problems. You know, your bladder and bowel gets stimulation from your brain and your spinal cord, and that stimulation can affect when you feel like you need to go to the bathroom, how long you can hold it, if you can actually pee. And so it's a really complicated system, and there are lots of contributing factors anatomically. So we're going to go over some of the common bladder and bowel control problems. Stress incontinence is when you have leakage, when you increase the pressure in your belly. So if you cough, laugh, sneeze, exercise, that would be the stress incontinence. Urinary retention is when you can't pee. Overactive bladder is when you feel the need to go to the bathroom and you leak before you get there, or sometimes if you just leak randomly without doing anything at all. And then fecal incontinence is when you leak stool without wanting to have that happen. So again, as I said, stress incontinence is leakage when you sneeze, cough, bend, lift, climb stairs, and often people will try to go to the bathroom or, you know, earlier to avoid having an accident. I'll have lots of patients will come in and say that if they don't empty their bladders before they exercise, they'll have issues. Stress incontinence is something that is not treated by the Medtronic products that I'm going to talk to you about tonight, but there are things that we can do for that. Often we'll send people to pelvic floor physical therapy to make your muscles stronger. There are other surgical procedures that we can do that can help with this. Urinary retention, again, is basically just not being able to empty your bladder. We see this both in men and women. In men, often it's associated with prostates. You can have a weak stream or feel that your stream really dribbles. Some people will actually need a catheter in order to empty their bladder, either one that stays in all the time or one that they pass in and out. Again, the products that I'm talking to you from Medtronic do not actually affect most forms of urinary retention. Overactive bladder is when you often have to go to the bathroom. It's very urgent. You'll have leakage associated with that feeling of needing to go to the bathroom. Some people will talk about how when they wash their hands, all of a sudden they'll have an urge and they'll feel like they have to rush, or they'll talk about getting home and they'll put their key in the door and then all of a sudden the urge comes on and it's uncontrollable. Maybe needing to have pads or diapers to kind of help keep them dry. And then frequency is technically defined again as going to the bathroom more than 8 times a day, although it does caffeine use and fluid intake in total does play into that number. Or the feeling just like you never actually empty, like as soon as you go, you have to get up and go again. Fecal incontinence, the urge to have a bowel movement that you can't control, you can't hold it to make it to the bathroom, or you don't even realize it's happening and you just have stool come out when you're walking around. Again, people who have this condition will often find that they're planning their lives around their trips to the bathroom. They'll find stool in their underwear unexpectedly, and they also will use pads or diapers to kind of keep everything as clean as possible. So there are lots of ways to treat incontinence, and frankly, every single human is completely different. And so what works for you might not work for your neighbor, but there are lots of things that we can do to help. So some of that involves lifestyle changes. There are medication, advanced therapies. So some of the lifestyle changes, diet, specifically avoiding bladder irritants like caffeinated beverages. There's some foods that can really irritate your bladder, may help. Exercise is really helpful for both bladder and bowel function, getting your pelvic floor strong. And so again, we'll often send people to a physical therapist that's specifically trained in bladder and bowel dysfunction. And a lot of people know that those exercises is Kegels. I think there's a lot of value in those treatments. I'll often have patients come in and be like, oh, I feel like I know how to do that. And then I'll have them try to do the motion in my clinic and they can't. And so it's something that's a good thing to keep an open mind about, and can really help without being invasive at all, which I like about pelvic floor physical therapy. There are several oral medications for the urge type of incontinence, the need to go to the bathroom and not being able to hold it. They are daily medications. They do have potential side effects. There are two types. They basically work on two different receptors in the bladder. One relaxes the bladder from being able to squeeze all the time. And the other kind of encourages the bladder to not, to be able to fill more, to be able to hold more. Traditionally, some of those drugs can cause dry mouth, blurry vision, constipation, but we're having better drugs every day, and these side effects aren't prevalent in all people. And so it's usually what we do first line for urge incontinence is we'll put people on a daily medication, and sometimes we'll try 1, 2, 3 before we find one that works for people. And then there are the advanced therapies, of which 2 of them I'm going to talk in more detail tonight. Basically, one is the Medtronic InterStim system. That's actually both for urge incontinence from a urinary standpoint and fecal incontinence, which is pretty cool that it works for both of them. There's also the Medtronic Neuro system, which only is for bladder control. And then there's injected medications like Botox injections into the bladder. So Botox, people talk about injecting it into their faces to prevent wrinkles. We'll inject it to the bladder to prevent overactivity. It basically temporarily and partially paralyzes the bladder muscle to make it relax, so you don't have to go to the bathroom as often. You can hold more. We do this with a scope where we look through the urethra into the bladder. People are typically awake for this procedure and tolerate it just fine. It does need to be redone depending on the person. It lasts anywhere from 3 to 12 months. There is a small risk of needing to self-catheterize afterwards. I'll tell all of my patients that there's a very small chance of that happening. It's pretty rare. But it does work in a lot of people, and a lot of people like Botox as an option for their bladder urgency. Percutaneous tibial nerve stimulation is a device that Medtronic has, is the Medtronic Neuro system. This is a pretty cool system. It's really minimally invasive. I will say that it's a little bit more time intensive than other things. Basically, you've got a nerve that runs, I don't know if this mouse works. Yeah. So there's a nerve that runs right here behind your little ankle bone. And we place a small acupuncture needle right into the skin above that nerve. And then we stimulate the nerve for about 30 minutes. You come in at first for 12 weeks, once a week, get a 30-minute stimulation. And then if it works for you, you come in every 3 to 4 weeks for maintenance therapy. Again, it's great because it's not invasive at all, but it does not work in everyone. And unfortunately, it's one of those things where we have to try it to see if it works. But it's a great option for people that maybe don't want to be on a daily medication, but don't want to do something more invasive to try to improve their urinary incontinence associated with urgency. The sacral neuromodulation device is the InterStim. I call it a bladder or bowel pacemaker, just kind of anecdotally. Basically, it's a nerve stimulator along the nerves that come out of your spine that run to the bladder. And it's an implanted device that can help prevent urgency, frequency, incontinence, both of urine and fecal matter. They have both a rechargeable and a recharge-free device, which is kind of cool. We have options for all sorts of people. And the great thing about it is that if it works and it works for you, we do the surgery, we put it in, and then hopefully it lasts for most of your life. At this point in time, these batteries are lasting over 20 years. And so it's a really great option for people that have moved through some of the more conservative therapies and they haven't worked for them and they want to explore something more permanent. I do always tell everyone when we're talking about these devices, we consider success to be a 50% or greater reduction in symptoms. I think it's really good to set expectations appropriately with both urinary and fecal incontinence. You know, I wish I could make everybody 100% dry, but sometimes that's not a possibility. And so we do the best that we can with the tools that we have. But this tool is a really great option for people who have failed more conservative therapies. The way that we do it is you come in, you complete a baseline diary for me where you tell me all the times you feel like you had the urge, if you had an accident, how strong was your urge, did you have to change your clothes? And so I get a good baseline over the course of a week. We then do a sort of trial procedure where we put in a temporary device that stays in for a week-long period. You'll complete another diary for me during that course of time, and we basically look to see if there's a 50% improvement or greater in your symptoms from your baseline to your trial period. And if there is, then we talk about putting in a permanent device. It's pretty cool. The pacemaker comes with a cell phone and an app, and you can control it yourself. So you have somewhere between 7 and 10 programs on the app that stimulate the nerves to your bladder or bowels in different ways. You can change the program, you can turn your stimulation up or down. And so it gives people a lot of options to control their symptoms and to make the changes they need to in their own homes to get this device to work for them to the best of its ability. Lisa is our local rep. She's awesome at helping me take care of patients. You know, she's really great at teaching people how to use the app, making sure that we have everybody programmed appropriately. And between the two of us, we've had a lot of success with these devices for both urinary and fecal incontinence. Everybody always wants to know if these devices are safe for MRIs or to go through the security machines at the airport. And they are now. You know, previously older devices were not, but the new technology has allowed us to develop MRI safe devices. And so it really doesn't impact your ability to get diagnostic studies done otherwise. And you can walk through all of the scanners at the airport without issue. And so if this interests you, you know, if you find that you feel like you have the symptoms that we talked about today, whether or not you've already seen a urologist and tried some conservative things or not, it definitely would be something worth exploring, coming to our office and having conversations with me or any of my partners to see if you would be a good candidate for this device or any of the other treatments that I highlighted today. Again, in terms of the outcomes for the bladder pacemaker, we do find that people are really happy with the Medtronic device. 85% of people are happy that they have it from a bladder control perspective. There's significant improvement in quality of life. And for the bowel perspective, 89% of patients feel like long-term it was a successful procedure. And this is something that has been used for years. There's been over 400,000 implants put in over the 25 years that it's been around. So it's something that is safe and effective and has sort of stood the test of time at this point in time. And here's one of the ambassadors who feels like it's really changed her life. I think you guys got to see a lot of videos before we started this talk tonight that really great patients sharing the information and their own personal experiences. So I'd love to take some questions from you all, just generally about incontinence. For people in the room, I will repeat your question just so everybody who's on Zoom can hear it. Yes.
I'm sorry.